the game in 2026. This is Shani Sweets, Hot 97.9 FM.
Hot 97.9, where we bang the hottest hip hop and R&B. It's your girl Shani Sweets, the serious little thing in your ear. You already know what's going on. We're inside the Pretty Girl Playbook, and I've been talking about them a lot lately. And they're here again. Advanced Community Health is here to drop some gems. You know, it's that time. They got to keep us aware of what's going on. And today I have Miss DeAnna Harris. Now, we are joined by her. She's a medical doctor at Advanced Community Health, and she's going to talk about us focusing on heart health by making some lifestyle changes. First and foremost, how are you?
I'm good. Thank you for having me.
Amazing. Of course, thank you for being here. We love when you guys come through and drop some of these gems on us. Now, it's kind of crazy because I didn't know this, but it's Love Month, but it's also American Heart Month.
Yes.
Okay, so why is it so important that we actually talk about this at this time?
Yeah, absolutely. So in the U.S. alone, there are over 80 million people that suffer from some form of cardiovascular disease. That could be coronary artery disease, heart failure, hypertension is a big one, peripheral artery disease, and many other conditions that include that. And it's also been the leading cause of death for well over 3 decades. So if it's not something that a person suffers from, it's something someone in your family or friends do.
Okay, which is very, very, very true. Now, February is the month of love, like I like to say, but at the same time, like, can you break down what it means to make sure your heart, where all the love comes from, is healthy with your diet, like what kind of foods you should be adding or avoiding, just to support having a healthy heart?
Absolutely. So while the risk of cardiovascular disease can be hereditary, a lot of it has to do with what you're consuming. So a heart healthy diet, we think of whole foods. So your fruits, your veggies, your lean meats like fish. For your other meats like your poultry, pork, beef, just making sure they're lean and unprocessed. And then if you kind of are looking away from meats, plant-based proteins, your beans, your lentils, your nuts. Those are all great ways to incorporate some healthy diet. A Mediterranean style diet is often what we'll recommend. And then food that you just want to avoid or limit is going to be your processed foods. Your foods high in trans fat, carbs, sugars, high sodium. And a lot of these nutrients can be dependent on what your recommended daily intake is. So for that reason, I often recommend people meeting with a nutritionist.
Okay.
They really can kind of count down how many of these you should be having in each day, how much sodium, how many fats. And so it's a great way to learn.
I love that. The Mediterranean diet, I did realize for myself, that is a good way to, like, it's so good that you don't feel like you're missing anything, and then you don't really realize that you're gaining so much or like have so many healthy things a part of that meal. So yes, shout out to the Mediterranean, because I love, give me a Greek salad or something, like give me some lentils, I love all of that. Shout out to Sassoon, that's a good restaurant if you guys haven't, or you want to kind of get into a way we can have some good food and still kind of explore. Sassoon is a very good restaurant, I got hooked on it. Now, like, I've heard some things about, like, of course staying active is really important, but what about for people who aren't used to exercising? What's an easy way to start being more active without feeling like overwhelmed to kind of help you with that task of taking care of your heart?
Absolutely. So the simplest way I tell both my patients is to just start walking.
Okay.
So it's recommended to get like 150 minutes a week of moderate physical activity. And I know that can sound like a lot, but if you do 15 minutes of walking over your lunch for 5 days, you're already at 75 minutes.
Oh, wow.
So you really can just kind of do 30 minutes a couple of days, other days of the week, and you're already at your 150. And then of course you have the gym, and if you're not a gym person, like, you can do videos at home. There are a plethora of workout videos that you can pull up. And then I would say for anyone who does have any heart conditions, always clear any exercise program with your provider.
Okay. So you can't just because you don't want to raise your heart rate.
Yeah, you don't want to jump in and
and
something happens, and now you're like, oh, well, I'm not going to do that again. And
Okay.
it's like, no, I still want you to exercise.
Right, but you
Just
gotta
the
make sure
correct
you're doing it the
way.
right way.
Exactly.
I understand. Now, you know, here in Raleigh, there's plenty of trails and people, they're like social hikes now that people are doing, some of the gyms are doing. So that's super
Hiking
fun.
clubs.
Yeah, hiking clubs, stuff like that, run clubs. And just really, it's getting warm outside, you guys. Make sure you just try to get a breath of fresh air. Don't even think about like how think about it as if you're working out or anything like that, but just go enjoy nature, clear your mind, and then next thing you know, you done did 30 minutes and then you're good. So that it kind of helps out always. Like, so how do things like poor sleep and stress affect your heart?
Yeah, so I know most of us are guilty of not getting enough sleep. It's recommended 7 to 9 hours a night, which a lot of people aren't getting. Less than 6 hours, though, has been shown to increase the risk of obesity, type 2 diabetes, hypertension, strokes. So it just puts a lot of stress on your heart when you're not getting that reset time during that time where you are supposed to be getting that sleep.
Yeah.
And same thing with stress, you know, whether it's short-term stress or long-term stress. That can cause changes in the body that can then turn increase risk for heart attacks, arrhythmias, abnormal heart rhythms, and again, cardiovascular death.
You know, I think for a lot of us, we want to hustle, we want to work, all that stuff like that. Sleep is definitely probably not, it's supposed to be higher on the list, but it's probably really at the bottom.
Yes.
You don't really think of it as a necessity because like I got things to do, I got kids, or you know, lifestyles are just different. But yes, definitely get some sleep. Especially if you're in the nightlife. I gotta talk about it because you know, you guys, I be outside and I be with the DJs and I be like, boy, you gotta get it together. When is the last time you slept? But they travel. A lot of people travel to do their job, and the turnaround is very, very fast, and they don't really have that time to reset and rest. But I will say definitely self-care. Sometimes put yourself first.
Absolutely.
How
Your body will tell you
Yes.
when it can't go anymore.
Exactly. I'm very big on that. My body tells me a lot of things, even if it's nothing that's wrong with my body per se. Even if I don't feel right or the environment's wrong, my body will be like, I don't like this. So definitely listen to your heart, listen to yourself, your instincts, get some rest. Now, for people who smoke and drink, because we are outside, and that's like a social thing, it could be something that they do at home, but however it is, how do those habits actually take effect on the heart?
Yeah. So with alcohol, whether it's chronic drinking, so that's like your daily drinkers, or binge drinking, so my weekend drinkers, either of those have been shown to increase the risk of higher cardiovascular risk. So again, leading to increased risk of hypertension. And this is mostly like excessive use of these things, stroke, heart attack. And then while there are some notions that certain alcohol or certain amounts are good for you, there are no guidelines supporting alcohol consumption for heart disease prevention. And then of course with tobacco use, we know that's the leading preventable cause of coronary vascular disease.
Gotcha.
So cigarette smoke increases the risk of atherothrombotic disease. And that's just a really fancy way of saying that it forms a blood clot in the arteries. So that often is going to increase your risk of heart attack, stroke, peripheral artery disease, and even aneurysms within the abdominal aorta.
Gotcha.
Yeah.
That's something that we really need to get more information about with people that want to actually start practicing their heart health. What's one small step that they could take today?
Today, I would say my biggest push is look at what you're eating. I think learning to read a nutrition label is something a lot of people don't know, but it's probably one of the easiest ways for you to practice.
Those labels don't be in English.
Listen, that's what I'm saying.
They be in English, but it's like, what exactly am I looking at?
And so that's really my push, okay? If you know a nutritionist, I know Advance has one, but there's other ones out there. It's not just about dieting, it's about learning how to eat.
Yeah.
So like, find you a good nutritionist, they can walk you through those labels, and then you'll be a pro when you go grocery shopping.
I see one thing, I learned one thing that's on the label, and I look for that on everything. I be like, look, oh, that got zinc in it? Okay, all right, look, that's all, turmeric? Okay, I like that. But yeah, no, it is really important, especially like, I have friends that work out and stuff like that, and they're big on counting calories and stuff like that. So that's one way to start as well, is like, start with the numbers, but you definitely want to know what you're reading, what the language is, what's important, what you don't need, was just there just because it might add a flavor. You don't really necessarily need to have that in your diet. So yeah, you guys, make sure you go find your nutritionist. Advanced Community Health has a nutritionist, and I'm pretty sure there's some apps and stuff like that
Yeah,
that can
absolutely.
help you as well. Where can people learn more about Advanced Community Health Services and how to book an appointment?
Yeah, so you can find us online at advancedchc.org or give us a call at 919-833-3111.
All right, you guys, y'all heard it here. Thank you, Dr. DeAnna Harris, for coming through and allowing us to get some information about keeping your heart healthy. You know, Advanced Community Health comes through once a month to let us know what we can do to be here a little bit longer. And I need y'all to be inside the Pretty Girl Playbook with me each and every day. For more information, visit advancedchc.org or call 919-833-3111. And Advanced Providers are definitely here to support you with all your health needs. We're gonna get back into this mix. Of course, coming up, I got some throwbacks. I got Notorious B.I.G. with Big Papa right here on High 97.9.